When used under the direction of a healthcare professional or lactation consultant, nipple shields can be useful in certain clinical situations to help mothers initiate or maintain breastfeeding. This brief presentation reviews evidence-based information about the use of nipple shields as well as instructions for use and cleaning. Medela nipple shields are made of ultra-thin, flexible silicone which has minimum odor and taste. Medela nipple shields come in two types, standard and contact nipple shield, and are available in both sterile and non-sterile packaging. A nipple shield covers a mother's nipple during breastfeeding to temporarily help with latch difficulties, nipple soreness, and in transitioning a preterm infant to breast. In these situations, nipple shields can support breastfeeding until problems are resolved and the infant is able to breastfeed effectively. Mothers who have used silicone nipple shields for breastfeeding problems consistently and overwhelmingly report positive experiences with the shield. In several studies of women with latch or nipple problems, the vast majority of women reported use of nipple shields to be extremely helpful, allowing them to continue breastfeeding when they might have otherwise given up. Over the years, nipple shields have been used for a variety of challenging clinical situations. The most common reason mothers of term infants give for using nipple shields are latch difficulties related to nipple configuration. Women with flat or inverted nipples often need additional assistance with latch, especially in the early post-birth period. In these situations, before introducing a nipple shield, mothers should be encouraged to try different positions for breastfeeding. For example, the laid-back position, where mother is in a semi-reclining position and the infant is prone, might help the infant to use his innate reflexes to find the breast and latch. If assistance and positioning are not successful, use of a nipple shield can temporarily facilitate infant attachment to the breast until the mother's nipples become more accessible and/or the infant has learned to breastfeed without the use of a shield. Use of a nipple shield in these situations can create suction within the shield, drawing the nipple out. Therefore, when a nipple shield is used for an infant having latch difficulty, mothers should be advised to remove the nipple shield after a few minutes of breastfeeding. She should then try to attach the baby to the breast without the nipple shield. Mothers can continue to do this with each feeding until the baby is able to latch on without the shield. Some babies need only 1 or 2 sessions with the nipple shields, while others may need more. Nipple shields can be helpful when breastfeeding mothers are experiencing nipple soreness and cannot tolerate the infant nursing directly on the breast. Nipple soreness should be evaluated by a lactation professional to identify the cause and establish a treatment plan. While the nipple is healing, a nipple shield can be used, with the infant returning to breastfeeding without the shield as soon as the mother is more comfortable. At that point, latch without the shield might need re-evaluation to prevent the soreness from returning. In a recent survey of physicians and health professionals specializing in breastfeeding care, respondents reported the most common reason they use nipple shields in practice was to facilitate milk transfer in preterm infants. Preterm infants are born with immature sucking patterns and pressures that can lead to ineffective milk transfer when breastfeeding, even if their mothers have adequate milk supply and flow. Nipple shield use with preterm infants is a temporary measure until the infant's sucking pressures strengthen and the infant can stay awake long enough to take a full feeding at breast, generally around term-corrected age. When nipple shields are used with preterm infants, milk transfer should be assessed by test weights rather than the subjective measures such as observation. In 2000, Dr. Paula Meyer conducted a clinical study of nipple shield use in the NICU. In this research, nipple shields increased milk transfer in preterm infants by an average of 14 milliliters per feeding, with longer sucking bursts and better wakefulness. Another study has evaluated milk intake in preterm infants using a nipple shield for the first time. Preterm infants are slow to consume significant milk volumes at breast, sometimes with little or no milk consumed while breastfeeding. However, Klum and Promomo reported 60% of study infants consumed at least half of their feeding with their first attempt at using a nipple shield. Infants with low muscle tone or ineffective suck may benefit from nipple shields. For these infants, professional lactation assistance is recommended. If nipple shields are used, careful follow-up and test weights are extremely important to confirm infants are transferring adequate milk intake at breast. Use of nipple shields should always be monitored by a trained healthcare or lactation professional to ensure safe and effective use. When nipple shields are deemed appropriate for the clinical situation, correct nipple shield size is important. Nipple shields come in 3 sizes, 16, 20, and 24 millimeters. Nipple shield size will depend on the size of the infant's mouth, with preterm infants usually needing the smallest shield. A trained lactation professional or lactation consultant will assist with correct sizing. In any situation where milk transfer is expected, whether this is with a term or preterm infant, check for milk pooling in the tip of the nipple shield after several minutes of infant sucking. Milk pooling indicates milk is being removed from the breast and is available for infant transfer. When information is needed about the volume of milk transfer at breast, infant test weights are an invaluable tool. Research studies of term infants nursing with nipple shields indicate these infants have similar test weights as infants nursing without nipple shields and have similar increases in weight over time. Because each clinical situation is unique, clinicians should consider using test weights to evaluate milk transfer whenever nipple shields are used, especially in situations with preterm or vulnerable infants. Mothers using nipple shields can have a variety of breastfeeding issues, such as nipple soreness, problems with latch, preterm infants, or infants with feeding problems. In all situations, it's important to monitor both mother's milk production as well as infant's weight gain. Pumping after breastfeeding with a nipple shield can maximize milk removal and promote milk production, especially if the shield is used regularly. In addition, mothers using nipple shields should be educated to monitor their baby's weight gain and their milk supply for the duration of nipple shield use. To use a nipple shield, wash your hands. Turn the nipple shield halfway inside out and center it over the nipple. Slowly roll the shield over the nipple and areola and smooth down edges. When using a contact nipple shield, the cutout portion is positioned under the baby's nose. Support the breast with a C-hold. Mother should place her thumb on top of the breast and nipple shield and her fingers below, away from the areola. Moistening the edge of the shield with water or lanolin before breastfeeding can help it stay in place. Tickle the baby's lower lip with the nipple until he opens wide. Then quickly pull the baby onto the nipple shield so the baby takes as much of the nipple shield as possible into his or her mouth. Here you can see infants latched correctly and incorrectly to the nipple shield. If needed, repeat the process until the infant is correctly latched. After the infant has nursed for several minutes, draw the infant away from the breast to check for milk pooling in the tip of the shield. If over the course of a feeding, milk is not seen in the nipple shield, the infant may not have transferred milk. In some situations, a supplemental nursing system can be used with the nipple shield to supplement the infant while breastfeeding. In other cases, the mother might benefit from pumping for a couple of minutes prior to breastfeeding with the shield to elicit a milk ejection reflex. Cleaning the nipple shield is very important. Sanitize the nipple shield by thoroughly boiling in water for 20 minutes. Please note, some healthcare providers recommend washing nipple shields in hot soapy water. Check with your healthcare provider for instructions on cleaning. Store the nipple shield with the nipple facing upwards and keep in a clean and dry covered container. In summary, nipple shields can be useful in certain clinical situations to help mothers initiate or maintain breastfeeding. Independent studies report that mothers who have used nipple shields rate nipple shields as very useful in helping them overcome breastfeeding problems. Nipple shields are useful when infants have problems with latch, when mothers have sore nipples, and when preterm infants are transitioning to breastfeeding. Data from existing research suggests infant weight gain and mother's milk supply are not adversely affected by nipple shield use. However, nipple shields should be used under the guidance of a healthcare or lactation professional, with infant monitoring for the duration of nipple shield use. In all cases, they should be discontinued once breastfeeding problems are resolved. Please see package insert for more information.